that we have no additional positives. We have 3 positives, 99 negatives, 7 pending. We've got 7 people in quarantine. We have 1 person still in isolation. That is the 3rd person who tested positive days ago. And then we have the 1 death, unfortunately. I'd love to go around and do a round of introductions from all of our partners, and then we'll open it up to questions. Hold on a quick second. I got to mute our, oh, Mark, you're not on mute. Okay, so let's start with Shasta Regional today. Oh, Jessica, you're on mute. There you go.
There we go. Hi, my name's Jessica Candaby. I'm the emergency manager at Shasta Regional. I have no new updates to report. We're still testing people who need to be tested and following public health guidance.
Okay, thank you very much. How about we'll go to Mayor's Memorial next.
My phone wouldn't unmute. I'm sorry. This is Valerie Lakey at Mayor's Memorial Hospital District, and I am the Emergency Preparedness Director. We too have no real changes. We are just continuing to review our processes, meeting every day, staying in constant contact with our partners, and just preparing for what may come.
Thank you, Val. Mercy Medical Center.
Good morning. I'm Robert Folden. I'm the Chief Operating Officer here at Mercy. So just in way of a recap, we have done visitor restrictions. We have limited the number of non-essential surgeries that we're performing here on site. We have our tents set up as an extension of our lobby. And like everyone else on the phone, we continue our what we call our surge plan. So we're looking forward to any potential contingency that we might have to deal with. And our intention today is we're going to get some of those plans out to our broader staff so that our staff are fully aware of this is what might occur should an event happen. So again, I made the comment earlier about failing to plan is planning to fail, and we are not going to fail as a team here in Shasta County.
All right, thank you, Robert. Public health, Brandy or Karen, who wants to go first today?
I'm Brandy Isola. I am the Public Health Branch Director, and I don't have any additional updates.
Okay, Karen.
Yeah, I don't have any specific updates either. I guess I could just say that we appreciate the partnership with all of our healthcare community. And I think one of our main areas of focus right now is to address this issue of testing that seems to be on everybody's mind as a frustration for the community. It's a frustration for us. It's a frustration for providers. And so trying to do the best that we can and coming up with some creative strategies to see what we can do until some of the pipeline of supplies and materials and test kits that are available, test technology improves.
Okay, thank you, Karen. Dr. Ramstrom, any of our media folks, we are ready for your questions.
Yeah, so you said 3 had tested positive, 99 tested negative, so 102 tests have been given throughout the county, essentially. Is that correct?
Those are the tests that have been done in the Shasta County Public Health Lab. That does not count the tests that have been done in commercial laboratories.
Gotcha. Do we have, I've heard somewhere that there was a shortage of test kits available. Is that true, or are we pretty well stocked for people who might have symptoms that want to get tested?
So I can take that. At Public Health, Shasta County Public Health Lab, we don't have a shortage of test kits per se, but there are a lot of supplies that are needed for the whole test process, and are on short supply of some of those. And so If that wasn't the case, we probably could open up a little bit, but because the stream of even the test kits is unpredictable right now, it's not like we could just go on and online and order anytime that we want to resupply. We're having to prioritize who we're testing and then working closely with the outpatient providers in the hospitals to try and have a coordinated way that we're going about that. And so we're having ongoing discussions about that. We have something set up this afternoon to come up with, renew those strategies. We're just keeping an eye on it every day and tweaking as we need to, trying to keep our supplies maximized, turning over every stone to get what we need. But it's an ongoing challenge that we are just plugging away at.
Okay. How quickly are you guys test results back?
Next day.
Okay.
So I have a question. I have a personal story that might be relevant to a larger audience. One of my family members went to Sacramento about a month ago for a health appointment, and she got a call yesterday from the doctor she had went to, and the doctor told her to quarantine. She has to quarantine. And this is before Gavin Newsom's orders and all that. So I'm wondering, and this kind of touches on what Brandy said yesterday about county coordination. Is the Shasta County Health Department getting information from other counties on who maybe they're asking to be quarantined in our county? So maybe that would give a more accurate reading on the number of people quarantined here in Shasta County?
So I'll go ahead and take that. We would have an accurate number of the people who have been put on quarantine by our health officer. So we can keep track of that, and we do release that in our statistics, as Carrie talked about this morning. But as this situation grows and the spread continues from other sources, the situation that you described sounds like it was a little bit more of an informal quarantine. So she was probably, or I can't remember if you said it was a he or she was told to quarantine, kind of more of an informal, like you have been exposed and it's a good idea if you stay at home. So we wouldn't know about that if they didn't contact us.
Right. Yeah. I don't know if it's informal or formal, but they're taking it seriously.
Okay, other questions?
Well, I'll take another one. Kind of a shout out to Courtney Kreider from Channel 7. She has a story online today about this group called Unicast. They've put out a social distancing scoreboard about how they're rating how counties social distance. And while California is getting an A, that group gives Shasta County a D. So I'm just curious if, can we do better, or do you think that might be an accurate grade for Shasta County?
I can take that question. I saw that story and I looked at the source of the information, and I think we need to look a little bit deeper. I'm an epidemiologist, so I'm a little skeptical at report cards like that, and I do want to look a little bit deeper into the data behind it. However, I will tell you that I think we can do better. I think that the places that have documented widespread transmission in the more urban areas might be taking it a little bit more seriously because of that kind of increased situational awareness. So we continue to work within our community mitigation and education team to kind of sift through the number of complaints that we're getting from businesses who are not taking the stay-at-home order seriously. And so we're definitely working to try to get some education out about that and hopefully ease more into a better compliance within Shasta County.
Okay. Yeah. All right. Well, maybe following up on that, can you say how many complaints the county has received, the county health department, about businesses not complying with the social distance?
I couldn't give you an accurate estimate, but it's definite. And some of them were getting multiple complaints for the same businesses. And so they're definitely in the dozens, if not up around closer to 100 complaints. And you probably also saw that some of the law enforcement agencies are starting to launch sites where people can complain. and they are forwarding those to public health so we have a centralized location where we will be deduplicating the complaints and handling them in a kind of a prioritized manner. Like the governor has said many times, he's not wanting to go towards enforcement. He wants more of a soft touch. And so that's what we're doing. We're just working with the businesses to talk about ways that they can comply with the stay-at-home order, and really encouraging them to keep their customers and clients in mind when they don't comply with the governor's order.
Thank you.
Any other questions? We did have a couple questions from Steve Gibson yesterday. I don't know if he has called in today, but one of them, I think it looks like you answered that well, Brandy, about how well our business is complying with the governor's order. The other one is, if the virus is confirmed through testing, is it a crime to knowingly expose oneself to another person without telling them? Is that within our jurisdiction? Is that a question that we know the answer to?
I don't know if it's a crime, but I would say that would be probably unethical and disappointing.
Absolutely. Any other questions from our media today?
Well, one more. I was noticing you were taking Facebook questions from the public. Are there any questions there that you'd want to give answers to that the public is interested in?
I am not on our Facebook page right now.
Okay.
I don't see any. My staff is monitoring that right now. Let's see. I don't see anything. Tim, do you see any? See, he's on the call. He's muted. Hearing nothing. Looks like no. We did want to also share that okay, and Jill says no, there are no Facebook questions that we have not yet answered.
Okay.
We did have some chatter on Facebook yesterday about returning to work and employers requiring notes to work. And we wanted to remind people about the CDC's guidelines that people can return to work if they're fever-free with improved symptoms for 72 hours. And it has been 7 days since symptoms first appeared, and the person is getting better. At this point, it's not a huge challenge, but we really don't want to overwhelm our healthcare system with people seeking return to work notes. I think that's all we've got. Does anyone else have anything to add or any additional questions for us?
I just wanted to add to that clarification, Carrie, that it's especially harmful if the employer requires a negative test for them to return to work, because those are in such short supply. It would be almost impossible for our system to handle that kind of request right now.
Yes, thank you for that clarification.
Carrie, I would just like to add that this is really, our staff is really stepping up, and they're working extra hard, and it is a little bit stressful at times for healthcare staff. But I really want to say thank you to the communities that are supporting our healthcare workers so much. It's really important, and we value our staff, and we're just really trying to balance all the regulations and taking care of them, because they're very valuable to us as we move down through this process, because we just really don't know what's going to happen.
Absolutely, thank you for that. Okay, anything else to add for today? All right, we thank you again for helping us get the word out about what's going on in our community, and we will see you all again, same bat channel tomorrow at 11 a.m. Have a good day, everyone.
Yep, thank you.